Hello, everyone. This is Marianne along with Christine, Serena, and Tin. Our group will be presenting Norco. It's a Friday night on the MedSearch unit. Nurse Christine is new to the floor and looks to her peers for advice.
Hey guys, are you guys busy? I have a few questions on Norco and wanted to pick your brain if that's okay.
Sure, what's up?
Well, I wanted to get more insight on Norco to be more familiar with it.
Well, what do you want to know about it?
Well, what I do know is that it's a combination drug of hydrocodone and acetaminophen, and that it's prescription only, but that's it.
Yes, you are correct, Christine. Norco is a combination of hydrocodone, which is an opioid pain reliever, and acetaminophen that is not an opioid pain reliever. That is why it's prescription only. Vicodin, Lortab, Losec, and Zodol are the other brand names, but there are also lower cost generics available. It's a Schedule II substance with a high potential for abuse according to the FDA. Its therapeutic effects is that it's an analgesic for moderate to severe pain control. Hydrocodone works as an opioid agonist that interacts with primarily the mu receptors and slightly on the delta receptors that affects the central nervous systems and smooth muscle organs. It reaches a max serum concentration within 1 hour and has a half-life of about 4 to 6 hours depending on the dosage. Finally, it is metabolized by the CYP2D6 enzyme to its active form, hydromorphone. Now, with acetaminophen, we're still unsure of how it actually works, but we think it inhibits prostaglandin synthesis in the central nervous system, but does not inhibit the peripheral prostaglandin synthesis. The plasma half-life ranges from 1 to 3 hours. Pretty much, you're targeting two different pathways of providing pain relief in the body, which makes this drug pretty potent.
Hmm, that makes sense. But how does it move through the body?
Narco is administered via PO, which is by mouth, and it can come in tablet form and oral solution form if a patient has trouble swallowing.
Does it come in different doses?
Yeah, the different dosages for tablet form are 2.5, 5, 7.5, or 10 milligram of hydrocodone over 325 milligram of acetaminophen. Narco is rapidly absorbed from the GI tract and is widely distributed throughout the body for pain relief. The primary metabolism is by the liver and is primarily excreted by the kidneys. It takes about 10 to 20 minutes for narco to produce its effects, and its duration of action lasts about 4 to 8 hours.
What side effects should I be aware of?
Some of the most common side effects from taking narco includes drowsiness, dizziness, mood changes, nausea, and vomiting, constipation, and skin rash. And some adverse effects that the drug can have are liver failure, which is associated with the use of acetaminophen at doses that exceeds 4,000 milligram per day, or that the patient have underlying liver disease or ingestion of alcohol with the medication. Other adverse effects include slowed breathing, anaphylaxis, severe skin reactions such as the Stevens-Johnson syndrome, and tolerance, dependence, and addiction can develop from long-term use because narco is classified as a Schedule II controlled substance, which has a high potential for abuse.
I see. How about contraindications or drug and food interactions? What should I look out for?
Yes, when you give this medication, make sure you let your patient know not to take not to take it with alcohol because it may exhibit an additive CNS depression. And if your patient is on other narcotics, antihistamines, antipsychotics, anti-anxiety agents, this may also exhibit the same effect. But when combined therapy is contemplated, the dose of one or both agents should be reduced. Make sure to let your CNA know not to give grapefruit to your patient
Grapefruit? Why?
because grapefruit juice may increase the plasma concentrations of hydrocodone. There's a certain compound present in grapefruit that can inhibit metabolism of hydrocodone. Increased hydrocodone concentrations could potentially worsen or prolong undesirable medication effects, including respiratory depression, which could be fatal.
Oh, wow.
Yep, and make sure you ask your patient if he's allergic to hydrocodone or acetaminophen because this can cause anaphylaxis. The doctor may prescribe a stool softener because prolonged administration as what Serena mentioned earlier, can cause constipation. Norco is contraindicated to patients with severe respiratory depression like severe asthma, trouble breathing, and other lung problems.
Does it matter if the patient is male or female, or is the effect the same?
Well, keep in mind if your patient is female, prolonged use of Norco can result in physical dependence in the neonate and neonate opioid withdrawal syndrome shortly after birth. Chronic use may also cause reduced fertility. Also, breastfed infants of mothers on opioids, especially newborns, can experience drowsiness and CNS depression, even death.
I see. So, what labs would I need to monitor with Norco patients?
Well, as you know, Norco has acetaminophen, and acetaminophen has been associated with cases of acute liver failure. The risk of acute liver failure is higher in individuals with underlying um, liver disease and in individuals who ingest alcohol while taking acetaminophen. In patients with severe hepatic or renal disease, effects of therapy should be monitored with serial liver and or renal function test. And care must be taken not to exceed the maximum daily dosage of acetaminophen.
That's good to know.
And make sure you monitor your patient's vital signs. Educate him on orthostatic hypotension to prevent fall. Assess your patient for any side or adverse effects of Norco. Monitor any signs of withdrawal and let the patient know that Norco has a potential for abuse, just like what Tim mentioned earlier.
I see. Well, thanks, guys. I have a patient assigned to me that uses Norco. This really helps when I need to offer him some patient teaching.
You're welcome.
Now, let's go ahead and take a look at some patient teaching.
It's Monday morning and Nurse Christine is on the telephone nurse on duty.
Hi, I have a 30-year-old male patient on the line looking for a review on a recent narco prescription that was filled today. He has been experiencing chronic bilateral shoulder pain that has worsened over the past few years and now decreases his ability to do light housework and yard work. Prior, he was taking Tylenol without relief.
Great. You may transfer him. What's his name?
The patient's name is Tim. I'll transfer him now.
Hello.
Hello?
Hi, Tim. I'm Nurse Christine. I will be assisting you. Can you please verify your name, date of birth, and medical number, please?
Sure, it's Tim S. January 7th, 1992. Medical number is 57689.
Perfect. I see that you've been prescribed Norco. Is that correct?
Yes, it is.
And I heard you had questions concerning your Norco prescription. How can I help you?
Yes, I just wanted more information about the drug. I've never taken it before and just want to know what I'm dealing with.
Okay. Let me go ahead and send you a brochure that we both can review together. Is the email on file, iamtim@gmail.com, still the best email to use?
Yes, it is.
Great. Go ahead and please pull up the brochure and let's review it together.
Okay,
All
I
right.
got it pulled up.
All right. Perfect. Now, to start, the medication you're taking is Norco. It's made up of two pain relievers, acetaminophen. You may be familiar with the brand name Tylenol, and hydrocodone, which is an opioid pain reliever. Now, the main purpose of your prescription is to help relieve the chronic pain you're experiencing. Okay, so what I want to do is go over the entire brochure, and if there's anything else you'd like me to cover, I'll go in more detail. Okay, Tim?
Okay.
So, when taking Norco, make sure, please take it as prescribed by your healthcare provider, first of all. I see you're prescribed the 5 milligram. Is that correct?
Yes, it is.
All right. Well, go ahead and please take one by mouth every night at bedtime as needed for your back pain. When you take it, you're going to want to take it with food or milk if it upsets your stomach. Do you have any difficulty swallowing the medication in pill form, Tim?
No, don't.
Okay, good. Now, this medication can make you dizzy or drowsy. Please avoid driving or operating heavy machinery until you know how Norco affects you. You want to avoid drinking alcohol while taking it. And if you feel lightheaded, dizzy, or nauseous, lying down would be the best option. Norco can also cause constipation, so I advise that you drink lots of water and eat fibers such as fruits and vegetables. Acetaminophen, one of the components of Norco, is also found in many over-the-counter prescriptions and products. I would not combine Norco with other medications containing acetaminophen in order to prevent liver damage. If you aren't sure, talk to your local pharmacist to make sure you're not taking too much acetaminophen. If you have been taking opioids long term, don't stop taking them suddenly. You might need to cut back slowly over the course of a few days or even weeks. When it comes to possible side effects of Norco, you might experience some constipation, nausea, sleepiness, vomiting, tiredness, headache, dizziness, abdominal pain. Make sure to call your healthcare provider if you have any of these symptoms and if they are severe. Do not take Norco with alcohol, grapefruit juice, cannabis, antihistamines, antipsychotics, and anti anxiety medication. Taking a look at your files, I see that you're not prescribed any of these, so you don't have to worry about that. Also, do not take Norco if you have severe asthma, trouble breathing, or other lung problems, a bowel blockage, or have narrowing in the stomach or intestines, hypersensitivity to hydrocodone or acetaminophen. Also, get emergency medical help or call 911 right away if you have too much Norco to prevent overdose and have trouble breathing, shortness of breath, fast heartbeat, chest pain, swelling of the face, tongue or throat, extreme drowsiness, lightheadedness when changing positions, feeling faint, agitated, high body temperature, trouble walking, stiff muscles, or mental changes such as confusion. Now, Tim, is there anything from the brochure you would like me to clarify more for you?
No, this is great. I just wanted to make sure what not to take it with, and it has it all right here.
Great. If you have any other questions or concerns, feel free to reach out to us or call your doctor for medical advice about any side effects. You can also report side effects to the FDA at 1-800-FDA 1088.
Awesome. Thank you.
Thank you and have a great day.
This concludes our presentation.